Is there any evidence so far that case number 13 had close contact or interaction with a known or suspected case of COVID-19 in St. Vincent and the Grenadines?
I thought you meant ask all of them.
So do you want
No,
to
I'm going to ask one by one because
I see.
it would determine whether or not I have another one.
Well, the medical people are the ones to answer that. No. I know the problem.
Okay. As we go through the process of contact tracing, we also have to remember in terms of confidentiality, and we have identified some possible sources. Okay, I would say that we have identified some possible sources, but until we have more definitive, even as we recognize that sometimes you never will have a specific source, a clearly identified source, we have identified some possible areas of possible contact. And you see, I'm saying possible this often because we are currently in this investigation. Okay, Mr. Chance?
Am I allowed to? When you say possible, do you mean possible confirmed COVID-19 cases?
We are investigating possible cases. Okay? As you would understand, we do lots of testing. Right?
You have differentiated what is local transmission, community transmission, and the last COVID-19 patient is possible a local transmission. So my question is, what measures, different measures or steps have you taken to deal with this possible local transmission?
With every case involves contact tracing. And this is even more important in this situation. Contact tracing, I'm not sure if you all understand, is where we interview, we go into the communities, we speak with the individual, we speak with those persons around them, and it becomes sort of a widening circle as you attempt to identify. The importance of contact tracing is even greater here because you are trying to identify who and where you should be guided. It's not a blind science. It is based on where the person might have been, what are their contacts, what are their possible exposures. Even as we do that, and even before this, our strategy in terms of surveillance has been looking for any cases wherever they might be in St. Vincent. So even though all of our cases until earlier this week, we had definitive, this is somebody who came in and somebody who was under quarantine, we have always been looking for that case who might not be in that group of somebody who flew in. So if you look at the testing strategies we have used, we have not always tested someone who had a travel history, which is what an imported case would be. We have been tracking, looking, and that is what we will continue to do. So in terms of how have things changed, we will continue. We are looking at all of our influenza-like illnesses, and this is something we had decided before this week, where we were going to go into our clinics. We are going to try to identify past hotspots. We are also looking at our healthcare workers. These persons are the ones who would most likely get something and be most likely to give an infection. So we're looking at our vulnerable groups in terms of our elderly persons, our persons who are diabetics and hypertensive. So we have already identified some key areas, some key focus groups, and we will be looking into those focus groups, those areas to find cases, because that is what we need to do. We are not going to not want to, but we need to, our strategy is early identification. As soon as you can identify and you can quarantine and isolate, you have a better opportunity to slow the spread, which is our aim. We are all aware of the fact, as Prime Minister said, this COVID is here, it's in the world. It is something we are going to have to learn to live with to continue our lives.
My second question is, how many persons have you contacted and traced from the last patient?
The medical officer of health, Dr. Duncan, he is in charge of the community effort, and he is the person who is leading this extremely important component. And so far, we have identified more than 5 persons, and I will just say more than 5 because it is ongoing.